Why are 6 afraid of 7? 7, 8, 9.
Eleanor is a very brave, a very resilient, a very stubborn, and a very fun child.
Well, I had leukemia and I still have diabetes. It's a kind of cancer I get in my blood.
We knew that something was wrong, and we had an appointment, and we went, and I expected that we would leave there with them just kind of saying, why'd you bring her here? What's the big deal? And we ended up not leaving for 4 days. I think with the leukemia, it's a whole nother thing because you're afraid you have the chance that your child might not live. And that's the thing we struggle with even today, that it might come back.
And Eleanor's story is more complicated than most of the children we treat. Childhood leukemia is always complicated. The medicines that we use to treat childhood leukemia can make the symptoms of the diabetes much worse. So we were stuck in a situation of trying to treat her with something that we knew was actually going to make the diabetes more difficult to control. But it's amazing how much information parents have to absorb in a very short period of time, literally hours to days, in order to do this right. Eleanor's case is kind of a paradigm of how we need to have large teams of people involved in treating these children to get the best outcome. This is a team effort. And in Eleanor's case, it was a multi-team effort because she had her diabetes team, she had our team. Eleanor's family is the head of the team. The nurses, child life, all of the people who are indispensable in treating a child like Eleanor. It's amazing to see a child who's coming here for procedures which can be painful, which can be long. Families are here for IV treatments, which sometimes go on for hours, day after day after day. And yet, because of our team at UVM Children's Hospital and because of things like Child Life, children don't want to leave when their appointment's done.
One of Eleanor's admissions was on her 4th birthday. Late in the day, we had to be admitted, which was a big disappointment because we had to go to the emergency department and then got admitted. Child Life was waiting for her, and they came down to her room and they had a birthday sash. It said birthday princess, and they had all these birthday gifts. That admission was a real recognition of how much they had become family.
I remember the day that she was admitted to the hospital for leukemia, and I was laying with her in her bed, and she says, "Daddy, I can't seem to beat this sickness." But you knew that she was going to, and you knew that she was in pain, and she was trying to do it by herself, but at this time she needed some help. And she's giving me more strength than I knew I had just by watching her go through this process. So she's made me a better person, a better father by watching the courage and the strength that she has. Eleanor had a port planted in her body that allowed her to have blood and chemotherapy administered. I remember having a conversation with Eleanor, and she was very sad that the port was going to be removed because she was going to miss all her friends at the hospital. So that really says a lot about the people, about the Child Life team, as well as the doctors and nurses. They're incredibly genuine, honest, good people who took extremely good care of my daughter.